And the optic canal is that opening right there. And that's where the optic nerve and ophthalmic artery pass. And then the cell turcica, the pituitary gland, sits on that fossa. In the ethmoid, in the internal view, the crista galli, what does it do? That's where the falx cerebri attaches anteriorly to the skull, and then we have the cribriform plate, and the olfactory nerve fibers pass through those holes. So here we have the coronal suture. Here we have the sagittal suture. Here we have the lumboidal suture. And then over here, we have the squamous suture. Okay. So the greater wing should be right there. The lesser wing is right above that. The superior orbital fissure is also, let's see if we can focus in there. It's up there as well. And that passes through the lacrimal, the frontal trochlear, superior division of ocular motor, abducens, nasociliary, and inferior division of the ocular motor nerve. And then the optic canal. So part one, the cranial bones. Here we have the frontal, we have the parietal, and we have the occipital. And then we have the external occipital protruence right there. And that marks the attachment of a ligament that stabilizes the vertebrae of the neck. For the sternum, here we have the jugular notch, the manubrium, the body, and the cyphic process. The temporomandibular joint, the mastoid process, the styloid process, the external acoustic meatus, the squamous part, and the internal part of the temporal bone, we have the squamous part again, the petrous part, the internal acoustic meatus, and the mastoid process. And in the internal acoustic meatus, it provides a passage for the vestibular cochlear nerve, the facial nerve, and the labyrinthal artery. Here we have the lumbar, which makes 5. The sacrum, it's 5 bones. Consists of 5 bones, and then we have the coccyx. So the 4 curves of the adult vertebrae column is thoracic and sacral. Thoracic, sacral, which are primary, and they're both concave anteriorly. And then we have the cervical and the lumbar, which are both concave posteriorly, and they're secondary. The cervical vertebrae, which is up here, has 7. And then we have the atlas. The atlas is, it articulates with the occipital condyles, which allows us to nod, which allows us to, it does this right here. What is unique about the transverse process of the cervical vertebrae compared to those of the thoracic and lumbar vertebrae? They have holes in them called transverse foramen. The inferior nasal concha, what does it do? It's the bone forming the lower part of the lateral wall of the nasal cavity. For the mandible, this is the body, this is the angle, this is the ramus, the mandible condyle, the mandibular notch, and the coronoid process. The thoracic vertebrae has 12. This is the spinous process, the transverse process, the intervertebral foramen, the spinal cord passes through that. And then we have the body of Setrum right there. So here we have the true ribs. The first 7, 8 through 12 is the false ribs. The last 2 we call the floating ribs. This is the head and the neck, head and the neck of the rib. And then the ribs articulate with the vertebrae column posteriorly, and they terminate anteriorly.